Hi everyone, it's board certified plastic surgeon Sean Doherty from Boston, and I'm often asked by patients, what happens if something happens to my implants? Well, in general, you should see a plastic surgeon. This is assuming that you haven't had trauma to your chest or your breast, and in that case, I suggest you seek emergent care to treat that, but in general, you want a plastic surgeon to evaluate you. So what are things that can happen to your breast implants? Well, initially capsular contracture, so that's the tissue that forms around your implant naturally getting hard. Usually that happens in the first couple of years of surgery, and that needs to be surgically addressed. Or later in life, if there's trauma to your breast or chest, that may happen. And I urge you to see a plastic surgeon to help that. Then there's a rupture of your implants. Implants are not permanent devices. They can rupture with normal wear and tear, or again with trauma. Both saline and silicone implants can rupture. If a saline implant, which is what this is, ruptures, you would know right away. You would see immediate deflation on one side, and they need to be replaced. The silicone gel implant can also rupture, but the challenge is that we don't know that clinically, and that is why an MRI is recommended 5 years after the implant's replaced and every 2 to 3 years after that. And if there's a rupture, it's recommended your implants get exchanged. Most likely, your soft tissue changes over your implants later in life with age, weight gain, weight loss, pregnancy, or breastfeeding, and that needs to be addressed. And that is why you want to have a continuous relationship with your plastic surgeon to assess that and stay ahead of changes that may need to be addressed at one point. So in my practice, I like my patients to come and see me yearly after their surgical procedure to just stay ahead of things. So typically an implant stays where it's supposed to be, and then soft tissue descends or sags over that, and oftentimes that needs to be addressed by performing a lift. And so that can be done by downsizing an implant, increasing the size of an implant, or just doing a lift by taking the implant out. Oftentimes fat grafting can be placed as well to create a good size and shape of the breast, either with or without an implant. So there are a lot of things that can be done, and just the take-home message from this video is to stay in touch with your plastic surgeon. So I hope this is helpful. If you have any questions, please reach out. Thanks.